Most people might have been affected with low back pain at some point in their lives. It can range from mild to severe in nature. There are several factors which causes low back pain. One of the most common cause of low back pain is muscle spasm or muscle strain. Continuous sitting can cause strain in the muscles of low back and can cause severe pain. Sudden movement can also cause sprain of low back muscles and cause pain. Second most important cause is that due to herniated disc or disc bulge. Our backbone is made up of many vertebrae, and in between each vertebra there is a cushion-like substance called a disc. Some movements like lifting of heavy weight can cause this disc to bulge and result in low back pain. And this bulge disc, if compresses the nerves which goes down both legs, the person experiences back pain which radiates to the legs. If the nerve is compressed, the person can also experience numbness, weakness or burning sensation of the legs. Other causes of low back pain includes arthritis, that is inflammation of the joints of the spine, spinal canal stenosis, that is narrowing of the spinal canal which compresses the nerves and causes pain, scoliosis, that is curvature of the spine, osteoporosis, that is weakening of the bones of the spine, certain infections, tumors, etc. Pathologies of internal organs like kidney or uterus also causes low back pain as a symptom. The management of low back pain depends mainly on the cause and severity of the condition. In Ayurveda, the treatment of low back pain includes internal medications and external therapies like massages with or without oil and fermentation therapies, which are mainly focused on reducing the inflammation, strengthening the muscles around and also improving circulation. Certain exercises will also help to relieve pain. Thank you.